It's really great pleasure and honor indeed for me to welcome very important dignitaries coming all the way from United States and from Delhi. Dr.H.K.Reddy is the president of American Association of Cardiologists of Indian origin, all the way from St. Louis. Dr. Reddy,
Yes,
I
sir.
welcome you
Thank you.
to the premises and campus of WCCPCI 2015 at Abu Road, Shantiwan, Rajasthan, India on 6th of September. I have with me Dr. Poonam Malhotra. She is a professor of cardiac anesthesia in All India Institute of Medical Sciences, and she believes a lot in continuing medical education and also in public health education at large. What do you think, Poonam? You are coming for last 3 or 4 years in this conference. Do you find that this conference is different as compared to what we do in cardiac anesthesia or in any other allopathic conference in a 5-star or a 7-star hotel? You find the culture, the ambience and the environment is congenial with a healthy heart here, or it is toxic to the heart?
Thank you, Dr. Chopra, for inviting me to this lovely place again and again. Every year, believe me, this is one conference I want to come to discover myself in a very new way. Every time I've gone back, I found a different and a new me. So that happens when our thought process, our environment, and what we are listening and hearing and interacting with changes to a large extent. I may have done some 2021 conferences, lucky enough to be in AIIMS to do all that. But all the conferences, as you rightly said, whether in AIIMS for educative purposes as CMEs or workshops, or in a 5-star hotel, take back an academic message and do not give us what we need for a body. I think for a body you need a good IQ, you need a good EQ, you need a good SQ. A spiritual quotient is as important as an IQ. And most of us doctors in our MBBS curriculum are taught everything except 3 things. One is the financial state. Doctors are very poor financial managers. Second are the legal aspects, because we as doctors are very vulnerable to suing. And the most important, the development of our own EQ and to realize our own nurturing of the Krishna consciousness which is there in us, and to make it forward into an SQ. So this conference is a conference with a difference, at least for me personally. It enhances my EQ and I go back with a greater SQ. So that when I do a EQ, IQ, SQ balance in my own cardiac anesthesia conference, my conference comes out better. So it's a learning curve for me every year. Last 4 years, I don't know how to thank you and to thank the God that such a place exists, where we are all mentally free of all stress and go back rejuvenated back to our works.
Thank you, Poonam. I think the Poonam very nicely expressed, if I really make a small concluding remarks of what she said, that we all have intelligence. And she said it's the intelligence which may be in the consciousness, which may be in the mind, which can be also present in each and every cell of the body. Like we have 60 trillion cells in the body, and there are 6 trillion chemical reactions occurring every second. How do they occur? It's only by intelligence. That's what she expressed. And when we talk of intelligence, intelligence derived its word from inter, means in between, and ligare means choice making. We don't know in allopathic conference how to make choices, because what do we talk there is only statistical value. Target organ, how it is influenced, effective or not effective, statistical significant or not significant.
Outcome measures.
What she said is intelligence in emotions, intelligence at a cellular level, and intelligence at the level of consciousness. It is this intelligence which determine all kind of cues which she was mentioning. I think all those intelligent cautions, if originate from the spirit, from the unified field, or from the field of pure potentiality, or the field of infinite possibility, or the field of eternity, we can achieve everything. It's not only at the physical level. Very good expression, Poonam. I'm sure this message is very clear. We need to mingle science and spirituality. We have with us H.K.Reddy. H.K.Reddy is a very regular visitor, I know it. He was coming as a speaker throughout, I think for the last 7-8 years I'm seeing. I don't know whether he has come alone this time Otherwise, he comes always with his family, his wife and children. Everybody comes and enjoy here. H.K.Reddy, I know you are a great interventional cardiologist. You do a lot of interventions. But I find some of the interventional cardiologists say that they are perfect in their intervention. But at times, they are not able to succeed the way they want. So where is the problem? Is there is a problem because there is no divinity in it? Either there is no divine intervention by the doctor who is doing it, or the person on who is doing it is also not divine. When the intervention is divine, the success has to be 100%. What are your views on this?
I think I totally have to agree with you. The patient and doctor both are not divine. I think they don't have positive energy. So to continue what Poonam is saying, I think this conference gives you a lot of positive energy, happiness and satisfaction, stress-free environment. This is the only place that I have been to. You know, as you know, with Dr. Nanda, I go all over the world. This is the only place I feel happy when I come here. So the same thing with interventionalists, they are not happy, if I guess, with themselves, with the procedure, and with the patient is not happy. Both are not happy. The environment may be negative in a certain way. I think what you are saying is perfect because they have to bring the happiness, positive energy, a spiritualistic approach, holistic approach, and you feel like you're treating a human being, not just an object, not a business type of situation. I think those are the problems.
I think Dr. Reddy has brought a very important point. I never thought he was so intelligent. He is. He said it's the energy. The source of divinity is energy. What we call in our scripture as prana. We also call in English as a vital force. We also call it ruha in Arab, ruh in Islam. We also call it ki in China and chi in Japan. That's what I was talking about. I think if we have a prana as an interventional cardiologist and if we have a prana as a patient, success has to be 100%. This answer I heard for the first time. And wonderful. I asked this question to Ashok Seth. He said, I'm not sure. But he is very sure, he is very confident. I think this word has come, word of wisdom is fantastic. That it's the energy which needs to be enlivened. We say enliven your prana, enliven your ojas, and enliven your tejas. Then only we can have divinity everywhere and the result will be success to 100%. Dr. Reddy, you are involved in the interventional cardiology in a very, very big way. I know about you, what exactly you do. What do you think is the role of preventive cardiology in an arena of interventional cardiology?
I think preventive cardiology is 99%. Only 1% intervention. I tell all my patients in the USA that this is not the way to do it. I have to do it. I have no choice, but now I don't like to do these things one more time. And I also joke with them. Obama says only one stent for one patient. He says no more. So I just try not to hurt their feelings. You know, like to continue your the theme of thinking. So I just continue to try to infuse some positive energy into the patient, make them feel good. So if you criticize and if you have negative statements towards them, they're negative energy again. So basically, I learned a lot from your conference, from this place. I just carried it to USA, and then actually they said, that's really good. I never thought of that. The American patients, they don't think of these things, spiritualistic things. Only when they go to church, the pastor says something good. But apart from that, I said, they come to me and said, you say something nice. I like it. They're very spiritualistic. Human beings are mostly spiritualistic. That's the distinguishing feature compared to other animals, right? So we need we have spiritual appetite, and that appetite is satisfied here. So, and we need more of these conferences.
Fantastic expression. Dr. Reddy says, we have a spiritual appetite and we get a fulfillment in a conference like this. Very beautiful expression. We become more blissful if there is a spirituality within us and a spirituality outside us and a spirituality everywhere. A very nice expression by him, quoted Obama. He said, one stent per person, not more than that. What does it mean? It's very simple. That stent is not the answer. How many stents will put in 60 miles of the blood vessels? Right from the head to the toe, it's not feasible, it's not practical. And I think the answer is in divinity and spirituality. If we have a nice emotions and nice emotions, we are going to create a huge impact on the health of the heart. But if we have toxic emotions, our heart also become a toxic being. Whatever number of stents you put, again they'll get blocked and get restenosis. Still we do not know why some stents block and why others don't. Again, the same thing, the environment, the milieu interior within you and the milieu interior outside you, so-called milieu exterior. So exterior and interior, when there is no proper amalgamation or there is no proper equilibrium, is bound to create toxicity. Very nice, Dr. Reddy. I think your expressions are outstanding.
Thank
So
you.
I feel you have become more like a spiritual interventional cardiologist. That's a new nomenclature we can give you, and not only interventional cardiologist. Poonam, I think you're doing a lot of cardiac anesthesia in a place like Delhi, where there is a huge volume of rush of patients. What do you think when the patient are subjected to cardiac surgery or interventions? What is their feeling of those people? So far as the heart is concerned, do their blood pressure rise? Do their pulse rise? Are there any pacifiers which you adopt as a cardiac anesthetist to calm them down?
Yes, that's a very, very good question, which is my observation over a period of 17 years. I'm no authority on the subject, but if I compare the mortality and the morbidity of patients who are coming in for complex cardiac surgeries, before we see a patient for a day or so earlier, All India Institute is a high volume center. Our patients get admitted tonight and they're operated next morning. And they are with you for 5 days. And at the 6th day, they are in the ward and then discharged. But a patient with impure thoughts, with a lot of anxiety, with a lot of family tensions, is the one who's going to be morbid and sick. This patient is a patient who may or may not do well. The morbidity will remain high even in the post-op period. But when I see a smiling patient who's been spoken to nicely by a cardiac anesthetist a night before, given some soothing words along with the tranquilizers, the anxiety kept at bay, and brought into an environment of harmony inside the OR, all these positive one-liners or feelers within the patient makes the tissue or the protoplasm of the patient very positive. Most of our patients die from sepsis, and sepsis is also kept at bay if you give them positive thoughts which nurture their inner self. So once your inner consciousness is very well nurtured, you heal better. And besides a good protein diet and good monitoring care in the ICU, what you need then and there is a positive patient feeling. So that positivity in a patient cures 100%. It's the same as stenting in a patient. It's the same thing. You're doing it on an open heart, you're doing it in a closed heart. But I think as an anesthetist, we play a big role in pacifying a patient with positive nurturing thoughts along with the medicines.
I think Poonam has mentioned a very, very important point, that a smile on a doctor's face and a smile on a patient's face make all the difference.
Yes,
the same thing was expressed by Reddy, that energy, so-called positive energy in an interventional cardiologist and energy in a patient makes the outcome in a perfect order. And she mentioned it is the smile, it is the laughter, and we should know how this emotion is a divine emotion. It's only given to human beings. I've yet to see an animal laughing or an animal smiling. It's only human beings they smile, but they have forgotten the smile, because they are all the time in a toxic environment.
In fact, Dr.
If you see that it is the smile which is a tranquilizer, it is the smile which is an energizer, it is the smile which is a stabilizer, it is the smile which is a happinessizer, it is the smile which is an energizer, and it is a smile which is an equipoiser. See the potential of a smile, but people don't smile.
Very
A baby laughs 400 times a day, but an adult not even 4 times a day. I'm sure, getting a clue from what Poonam said, that a doctor should smile at least.
At least.
Unconditionally.
I say one thing. You see a small child, when he's scared of crackers, he comes and sleeps in his mother's lap, a 1-year-old. He's seen the crackers for the first time. He becomes indifferent and oblivious to the world, and he sleeps. As human beings, when we grow up, we become so attached to the environment that we don't become indifferent. And if you are giving positivity, then you are giving proteins, there is peace in the patient and a positive outcome.
So I'm really happy that both the speakers who are giant in their own field of a cardiac anesthesia and interventional cardiology, one from India, one from USA. Both have the same opinion. They are totally identical in their thinking, identical in their approach, and they mention very clearly a time has come. We need to change our perception from intervention to spirituality. And if we bring spirituality, intervention will have a better outcome. And the Obama's thinking will be right. Not many stent, only one stent,
stent.
and maybe after some time, no stent. Thank you very much.
Thank you.
Thank you.